Public health encompasses all organized measures implemented in the prevention of disease, the promotion of health, and the prolongation of life among the population. The purpose of public health interventions is to improve the health and quality of life through prevention and treatment of disease. The Public Health Agency of Canada is responsible for public health responses. Health prevention is grouped into 5 categories, which are primordial, primary, secondary, tertiary, and quaternary prevention. Primordial prevention involves the identification of factors known to be a health threat and hindering such factors from being established in a population. These factors may be behavioral, environmental, economic, social, and cultural. An example of primordial prevention would be banning cigarettes in a country for future generations. Another example is making it a requirement by law to wear a seatbelt in the car. This mandatory seatbelt legislation resulted in a decrease in traffic fatalities by over 50% between 1975 and 2003. Primary prevention is the level of prevention at which health promotion measures are taken rather than clinical treatments. At this level, prevention of disease and sickness is the main focus, which aims to reduce the incidence of disease, prolong life expectancy, and help with the overall quality of life. One example of primary prevention includes receiving vaccinations. Vaccinations reduce the risk of contracting illnesses such as measles, polio, and influenza virus. Eating nutritious meals daily also helps prevent the risk of obesity and its complications such as hypertension and cardiovascular disease. Secondary prevention is the measures taken after one is exposed to an illness. The main goal at this level is to prevent it from getting any worse. Examples of secondary prevention are screening for tests like mammography to detect early signs of breast cancer, or blood pressure tests to detect hypertension and prevent such complications such as a myocardial infarction. Secondary prevention is used to detect a disease at an early stage to avoid more costly measures. Since interventions cost a lot more than simple solutions, it is at everyone's best interest to get checked out as soon as possible. Tertiary level prevention is the third level of prevention, which deals with the lifestyle of a person after developing a disease. In other words, in the tertiary level, an individual has already been diagnosed with an illness, whether it is to be a reversible or irreversible, acute or chronic. The purpose of tertiary level of prevention is not to eradicate the disease or illness, but is to not let the disease progress further and help an individual maximize the longevity and the quality of life. For example, an individual diagnosed with type 1 diabetes would be prescribed insulin shots by his or her doctor to continue with a normal lifestyle. Quaternary prevention is the 5th level of prevention that focuses on identifying patients at risk of overmedication, protecting them from new medical invasion, and suggesting interventions which are ethically acceptable. This type of prevention consists mainly of methods to avoid results of unnecessary or excessive interventions in the health system. Some examples of quaternary prevention is protecting vulnerable groups such as the homeless and elderly from overdiagnosis or being excessively medicated. Another example is limiting the use of X-rays and unnecessary overexposure to radiation that can lead to detrimental effects later in life. The primary objectives of public health in the 5 levels discussed are health promotion and prevention. Public health organizations use a preventative chain of command in order to reach those objectives. Primordial, primary, secondary, tertiary, and quaternary levels of prevention all work to aid individuals based on different stages of their lives. It is on the reliance of these preventative levels that the population is as healthy as possible.